Hello, I'm Paul Peterson, and welcome to Aging Well in LA. Today we're at the neighborhood offices of a podiatrist, Dr. Ilona Kashanian. We are going to talk about your feet, how to take care of them, what problems you might look for, especially for our senior population. So please stay tuned to Aging Well in LA. Welcome back to Aging Well in LA. I'm Paul Peterson, and I'd like to introduce you to Dr. Ilona Kashanian, who is a podiatrist par excellence. Thank you so much for having us here in your office. This is a busy place.
It is a busy place. It's a wonderful place for the community, for this area.
Well, now, I've noticed that the patients that I've seen this morning are of a certain age, and I wonder if you could tell me how the problems of the foot and our seniors are involved with each other. What's the connection?
Absolutely. We have a large patient population. The geriatric population is about 90% of what we see here. And as our population is aging, the incidence of diabetes, hypertension, peripheral vascular disease is increasing as well. We can take care of it medically, but they still have a lot of foot and ankle manifestations.
Right, of course.
So our patients are living longer, our population is living longer, staying active longer, but our body parts are just falling apart.
Right. Now, in terms of care, preventative care, foot hygiene is important, and yet our feet are so darn far away.
I know, and it's our last place that we look at.
That's right.
You know, God forbid, if you have an injury or an accident, you know, the emergency doctor checks your brain, your heart, your spine, your lungs, and the foot and the ankle is the last place, is the priority, absolutely.
And I've noticed that many of the senior ladies that I had lived with and gotten very close to, there were a lot of foot problems, bunions and calluses and hammer toes. Are those the things you deal with here on a daily basis?
Absolutely. 90% of what I see is the ingrown toenails, the thickened nails, the calluses, warts, skin problems. It's mostly dermatological disorders that the podiatrist deals with, and then we have some of the arthritides, some of the biomechanical sports medicine injuries we see.
Well, we're going to look forward to seeing you in action, and I think we're going to start off with the thickening of calluses, as you had just mentioned. So stick with us. This is going to be a very interesting show.
One of our main concerns with a diabetic patient is the calluses that you see on the ball of the foot. Calluses, dry skin, no big deal. But when these calluses become thick and they grow into the skin, they can become pre-ulcerative lesions where they grow in and cause an opening in the skin, and then can cause cellulitis, osteomyelitis. So this is a preventative measure where we go in and we clean this area out and prevent the skin from getting too thick. Also, you can notice the thickening of the toenails. The patient has hammer toe deformity, walks on the tips of the toes. Walking on the tips of the toes, the nail becomes ingrown, possibly causing an ingrown toenail or skin and or nail infection. So this is preventative in the diabetic patient population.
Now, the diabetic patient we saw with the calluses may also have other symptoms such as swollen ankles.
Patients who have diabetes also have a history of peripheral vascular disease. And here we have an example of a patient with diabetes as well as peripheral vascular disease that's causing a lot of foot and ankle pain. There's swelling that is occurring in her foot, in her ankle, that's moving up her leg, knee, as well as her hip. One of the things that we can help with the patient is first we need to make sure that we're ruling out any kind of bony malalignment or bony abnormality. Because of the swelling, now we need to take an x-ray to make sure that we're not dealing with any kind of bony abnormality or bony malalignment. If we look at the x-ray that we've taken today, and I always like to educate the patient, black is air, white is the bone. Bone should always be nice, smooth, should be no malalignments, no cracks in the bone. What we're noticing is just mild arthritis in the big toe joint, as well as, this is like the mid-arch area, which we call the mid-tarsal joint. There is a bit of arthritis, and this is where most of the swelling is occurring. So we have swelling secondary to osteoarthritis as well as peripheral vascular disease. There are several things that a patient can do to help with the swelling, and being a diabetic, this patient is going to be educated about the proper shoes. A shoe that's going to be deep, wide, and will give her a lot of support for her mid-arch as well as her ankle will greatly help with the swelling. Again, this is a vascular problem. 40–50% of the swelling can be helped with the use of proper shoes as well as an ankle brace that we're going to dispense today to the patient. Here's an example of a patient who suffered a stroke on the left side, and you can appreciate the foot drop, how the patient is walking toe heel, toe heel. We can help this patient with the use of an ankle-foot orthosis and proper shoe gear.
Now here's a tip. Good footwear is a preventative measure when it comes to taking care of your feet.
A lot of what we do as foot specialists is educate the patient about shoes. There are geriatric patient population, especially our diabetic patient populations, are encouraged to walk a lot, be active, to exercise, to reduce their blood sugar if they're diabetics, to help with their heart disease if they have peripheral vascular disease or cardiac abnormalities. They come in and they state, oh, I have a foot ache, my arch hurt, or the ball of the foot hurts. One of the things I try to educate patients about is shoe wear. Shoe wear is one of the most important things to prevent as well as help with sports injuries. Again, these are our geriatric patients. They're not power athletes, but they still have a lot of the sports medicine injuries, like the plantar fasciitis, like the metatarsalgia. One of the components of a shoe that I like to educate patients about is that a shoe needs to be firm. You hear a lot about this barefoot running that only causes stress fractures. A shoe should be very light, as well as the heel counter needs to be nice and firm. I should not be able to squeeze the heel with my two little fingers. Second thing you should do is take a shoe, any shoe. A shoe should bend at the toes, because when we walk, our foot bends at the toes. Some shoes are able to be squeezed and turned into a pretzel. That is not a very good supportive shoe. Firm heel counter and firm side to side. Those are the components that educate the patient. Third thing to look for is an insole. A lot of these shoes, a lot of shoes that you get come with an over-the-counter insole that you can take out and either put your own custom orthotic or another more durable pre-made device. There are two over-the-counter insoles I recommend. There's the Spanko device as well as the Superfeet. These are firm devices. You have a lot of the soft gel-in cushion. They do nothing. Again, these are over 150-pound patients who put a lot of pounding on their feet. The firmer the device, the better. The plastic insole helps with supporting the weight, and the cushioning helps with the callus formation, with the cushion, with the frictions, the pre-ulcerative areas. We also have a custom-made orthotic. Once the pre-made stops working or doesn't work properly, we have a custom-made device. This custom-made device is custom-made to the patient's foot, where I take, or a foot specialist takes a custom mold of the patient's foot. This aids the patient in supporting their arch, supporting their foot, and again, allows for proper propulsion. So what I try to educate the patient is the shoe gear as well as an insole, either a custom or an over-the-counter device. There's a lot of over-the-counter ankle braces that the patient can get, sport Heart Smart foot locker that will help with the swelling that occurs around the ankle. If it's secondary to an ankle sprain, a sports injury, or even in this case where we have the peripheral vascular disease. Here, patient always wears a sock, always put an interface between the patient's foot, ankle, and the brace. And now I will demonstrate to the patient how to put it on. What I like about this type of brace is it's a laced up as well as a Velcro type of brace where the patient is able to lace it up and Velcro it, gives the foot and the ankle and your arch a little bit of support. So wake up in the morning, put a sock on. You need 5 extra minutes in the morning. You put this on. Are you going to be able to do this?
I don't know because my hip is really...
Do you have somebody at home helping you out?
No.
Do you have a caregiver that comes in
Yes, once a week.
once a week? Okay.
So far. They just released me from the hospital.
Okay. Are you going to be able to get somebody to come in and help you a little bit?
They are trying.
They're trying to work on it? Okay. The patients needs appliances, need special braces, special shoes, but are unable, or even like the simple thing about putting cream on their feet. They cannot reach their feet. So because this is so swollen, I might not go as far as this. I'll go this way. But I want you just to see how supportive this feels. And then there's 2 Velcro straps. When I sprain my ankle, I wear this. You take the first strap, put it on top. Doesn't matter which one you do first. Put it around the top, come around here. Take the other strap, put it around, put it here. So you have like an X going on top. When you were looking at the shoes and you said you wanted something higher up, this is, you know what you need. You just don't know how to go about getting it. The most important thing is to have the patient put it on a daily basis, and if in this case where the patient cannot do it herself, having somebody, a caregiver, a relative, a neighbor come and help every morning with putting the ankle brace on. What we want to do for these patients is to increase their daily living activities and make sure that they have a healthy living style.
During the summer months, it is necessary for diabetic geriatric population patients to know about hydration.
During the hot summer months, one of the things we try to educate our diabetic geriatric population patients is about hydrations. A lot of our diabetics are on hypertensive medications. During the hot summer months, they forget to drink water, or their body temperature increases where they're not in cool places or air-conditioned homes or fanned homes, and what we need to do is make sure that they stay hydrated. Something that can happen secondary to dehydration in the diabetic patient who has high blood pressure is gout. Gout is a type of an arthritis that likes to attack big joints, our big toe joint, our ankle joint, as well as our knee joint. This is an example of the big toe joint being eaten away by uric acid crystals that accumulate in the big toe joint. This patient comes in with a hot, swollen toe. They can't even put weight on it. This is indication of an acute gout attack. It's an arthritis that affects the big toe joint, and the most important way to prevent it is with hydration, water, and keeping the body temperature cool.
Next, Dr. Kashanian shows us a healed ulcer that was caused by inadequate blood supply.
So here what we have is an example of a healed ulcer secondary to ischemia or lack of blood supply. So the patient came in with an open wound, and after multiple applications of antibiotic cream as well as pressure off devices, we were able to heal this ulcer along the outside of the ankle as well as around the big toe joint. Now we have to think preventative. We're looking at preventative ways to help this from reoccurring. We need to talk about orthotics, either custom devices, or like we indicated before, we're going to talk about the over-the-counter devices, like the Spanko device, where it's going to support his heel, support his arch, and take a lot of pressure off of his foot and ankle area. Today what he's going to go home with is two very simple devices, pads, cushioning that he can get over the counter from Walmart, Big Five, CVS. One is roll of foam. It's nice and it's cush. And what it's going to do, it's going to just slip on the big toe and it's going to cushion this area, prevent the rubbing. Second thing is the moleskin. Moleskin adhesive, very gentle on the foot, ankle, puts it on, and whenever it falls off, the caregiver, the wife, the daughter will be able to change this. We will see the patient on a regular basis, and here we're now going to concentrate on preventing reoccurring of this ulceration.
Dr. Kashanian, tell me about the many factors for diabetes that impact your practice.
Absolutely, and the reason we focus on diabetes as podiatrists is because it's multi-systemic. You know, it affects the eyes, it affects the kidneys, and most importantly, it affects the nerve ending to our foot, ankle, as well as our fingertips. So one of the things we worry about is when a patient comes in with a big open wound on the bottom of the foot and doesn't even feel
Right,
it.
didn't even know that they had an opened wound. And of course that goes to personal hygiene. It's kind of the last area you check.
Absolutely. You know, our feet are always in shoes, hopefully. We're walking around. You know, at the end of the day, we just take off our shoes and socks and not think about it. One of the things I try to educate the patient is to take their shoes, shake it, make sure there's no rocks, pebbles, a piece of a nail or wood, splinter, stuck in their shoe.
Right. Well, it's kind of like the pee in the mattress, though. If I have something in my shoe, I know it. You know, many times, the only time we hear about foot issues are sports injuries, and you see that in your practice as well, right?
Absolutely. Again, these are the geriatric patients that need to exercise, whether they're diabetics who have cardiac problems, where their primary care doctors says, okay, get on the treadmill, go on to the park, go on the track, and start walking.
Get walking, start walking,
and
all
they're
of a sudden,
walking, right, in the wrong shoes, in the
Wrong
bad
shoes.
shoes.
Yes.
No support. And this is where we educate the patient on the sports medicine injury,
Right.
as well as how to prevent it and how to heal from it.
And spending a little extra money on quality footwear is a good idea.
Always
I
important.
see too many people when these unsupported slippers, and you go, not only is it risky for falls, but you're not providing support for your feet.
Absolutely. It's like putting pillows, walking on a piece of cotton. It feels good, but in the long term, it's not very supportive.
Right. Now, how would some of these manifestations of diabetes affect a person's falls? Do they lose their balance? Is there a lack of sensation in their feet?
Right. So here we're dealing, you know, nerves have two innervation, one for muscle,
Right.
for our muscles to fire so we can walk, but nerves also help with sensation. And a lot of their proprioception equilibrium gets compromised with the neuropathy as it moves up to their hips and their knees and the upper extremity as well. So here we educate them about not only proper shoes, but physical therapy modalities that they can do at home, stretching, strengthening exercises to help with ambulation. And then there's extra support like an ankle-foot orthosis that we can prescribe for the patient.
Now,
as
you
well.
mentioned kind of in passing, but staying hydrated is important. So many of our seniors get dehydrated and don't even know it.
Right. Especially now with this hot summer months coming up, we'll worry about the diabetics who get dehydrated, the hypertensive patients who are on hypertensive medications who get dehydrated, because that could accumulate into a gouty attack, high arthritic, painful, swollen joint, and we're trying to prevent it.
This has been so informative.
My pleasure.
Thank you. This has
My
been
pleasure.
a treat.
Thank you so much for coming
thank
in.
you. It's our treat. And now a very special treat. Dr. Kashanian's sister is our LA Department of Aging's very own Dr. Annette Lewis, one of our contributors on Caregiver Corner. Her subject today just happens to concern foot care and falls. Take it away, Dr. Lewis.
Today I'm going to be speaking to you about fall prevention. Anyone is at risk of a fall, any place, any time, whether at work, indoor, outdoor, on vacation. The risk of a fall increases as we age. Every year, 1 in 3 people 65 years or older in the U.S. falls. Falls can lead to a small scratch, a bruise, but sometimes it could be more devastating, leading to surgery, hospitalization, or even death. So quality of life is impacted by a fall or a fear of fall. And with that, there are costs. The individual loses their confidence, loses independence, mobility. Sometimes they are depressed and they isolate themselves. But the fall could also impact the family. The family has to step in and help. They have to change their work schedule. There is financial stress. So everyone is impacted. So let's take a look at the risk factors for falls. What we don't have control over is our age. And as we age, we are at higher risk of a fall. But what we do have control over is our health. So what I'm going to be speaking to you about is how to evaluate yourself or your loved one from head to toe. So I'll be speaking to you about medication usage, health condition, level of physical activity, and let's evaluate one's environment. So first, let's review your loved one's medication. The more medication one takes, the higher risk they are for a fall as a result of the side effects. So make sure you follow up with their doctor and their pharmacist to review their medication. Make sure they're taking their medications exactly as prescribed by the doctor. Find out who prescribed it, why are they taking it, how often are they supposed to take it, and if there are any specific side effects you need to know about. Also, make sure your loved one stays hydrated. What that means, make sure they're drinking plenty of water. When an individual becomes dehydrated, it affects their blood pressure and can lead to falls. Foot care is also important to help prevent a fall. What we're talking about is having your loved one being seen by a podiatrist or get regular pedicures to make sure that there's no corns, calluses, ingrown toenails, right? So when a person is in pain, when they're on their feet, they're more likely to injure themselves, fall, or trip. I wanted to share with you some tips about proper shoes. The proper shoes to buy to make sure we avoid tripping and falling. So here's a regular tennis shoe, and the way you find out which kind of shoe will be a healthy shoe for you is you place your thumb on the back heel and try to press down. If it's strong and sturdy, that's good. Make sure that there's a thumb distance between where the shoe ends and where your toe ends. Make sure that the front part of the shoe is able to bounce. Also, make sure that the shoe doesn't twist like a pretzel, and this doesn't. What makes a good shoe is that it's quality shoe, not necessarily an expensive shoe. So you could find a good shoe for $20, $30, okay? So just make sure to follow some of these safety tips. Avoid wearing flip-flops or slippers because that will increase the chances of a fall. Also make sure that the bottom of the shoe is a non-skid shoe. A good time to buy a shoe is in the afternoon because that's when the foot is swollen. When you get home and you're trying on your shoe, it will feel nice and comfortable. Rather than sometimes when we get the shoe and we try it on a different day, it doesn't feel right, it's not comfortable because you bought the shoe in the morning when your foot wasn't swollen yet. So now it's slipping, it doesn't feel right. Physical activity is critical in fall prevention. Why? Because we help strengthen our muscles, our bones, maintain flexibility, more balance and coordination. And when I talk about physical exercise, it's basic exercises like gardening, dancing, walking, tai chi, or even yoga. It's important that you remember that when you're sitting, sit tall. When you're standing, stand tall. And when you're walking, walk tall. Now that we looked at personal health, medical and physical, let's check your loved one's environment. At least 50% of falls occur in the home, and I actually feel that it's much higher than that. So let's take a look and see what can we do at home to make sure your loved one is safe. First, make sure there is no clutter on the floor of books, toys, wires, various objects, and yes, even small little pets. Make sure that the pathways are well lit in the hallway, going up the stairs, and also at night, make sure that there's a night light in the bathroom. When we're looking at the kitchen, make sure that there are no spills, water stains by the sink, or spills by the stove or oven when your loved one is cooking. Take a look at which items your loved one is using on a regular basis. Make sure they're not reaching up high to get their plates and bowls. Make sure to bring it down at their level. However, if they do have to climb up, make sure that you use a stepping stool that has a handrail for support. In the bathroom, look and see, are there grab bars? Is there a non-skid mat on the floor? And yes, like I said, make sure that there is a night light available, especially at night when they're getting up multiple times. We have several resources through the Los Angeles Department of Aging. Please call us at 800-510-2020 and learn more about our multi-purpose senior centers, which have fall prevention classes, dance classes, exercise classes, and a host of other activities. Falls can be prevented. So remember, review your loved one's medication usage, make sure they get doctor's visit on a regular basis, help them maintain an active life, and make changes in their environment, especially their home. So remember, sit tall, stand tall, and walk tall. That's all for today on Family Caregiver Corner. We'll see you next time.
Thank you for joining us here on Aging Well in LA. I hope you enjoyed the show.